I'm telling you, Mary, it's intriguing how one small bone in your neck can lead to big problems throughout the rest of your whole body.
Problems like headaches, dizziness, back pain, neck pain, and maybe a combination of problems. That was the case for Sarah Preble.
Yeah, and we're going to ask her about that, and Dr. Drew Drummond from the Spinal Balance Health Center. Thanks for coming in.
Nice
guys.
to see
Appreciate
you again.
it.
Nice to meet you.
Sarah, what was bothering you? What was the problem?
I've always had back problems, lower and upper back pain. And it had finally gotten to the point now where it was getting into my neck real bad, and I just needed to do something about it because I was just uncomfortable all day long sitting at work.
I see you, and you're a young person. So for you to say, I've always had problems, how back did it go? When you were younger? How young?
Yeah, I have scoliosis, and then as I progressed through my teenage years, it just got worse. The pain did. I don't know if it has a whole lot to do with the scoliosis. I think I just inherited maybe a bad back.
Yeah.
We've got one of those in our family too. So you had scoliosis. So did you try other treatments? I mean, you got treated for scoliosis, and then
I did.
You had back pain, for years after that. What other treatments did you try?
I've gone to a couple different chiropractors, and I've actually gone to another back doctor who gave me the two options of either having medication pretty much to cover the pain or to have surgery, and surgery wasn't an option. The two chiropractors I went to, one didn't really help. I tried a different one that was okay. It just wasn't convenient for where I work and day to day.
Well, it's interesting because he's a chiropractor, but what he does is totally different.
It is.
So when you first go to the Spinal Balance Health Center and you visit with Dr. Drummond and he adjusts you, what did you think about it?
To be honest, and I've told him this, I was very skeptical. I mean, it was such a different type of treatment than what I've expected. I'm used to getting cracked, popped, twisted every which way, and this is nothing like it. It was crazy. I was very skeptical.
Right. We've talked to many patients like you, and they've all said the same thing because it's not a very
so gentle.
It's
It
a
is.
gentle procedure, is what it is.
Did it work?
Yes.
How long before you went in for a treatment? Your first treatment. When did you start noticing some relief?
Probably about a week and a half, and it was just night and day.
That's amazing. So, Dr. Drummond,
Yeah.
you don't take it personally when people say, I was surprised this worked because it was so gentle. We expect,
it happens all the time.
Right, you expect a big resolution to a big problem, but in this case, that's not it. So what's NUCA?
Yeah. Well, NUCA is a treatment that fixes underlying problems with your structure. What causes chronic pain are problems that exist over long periods of time and don't go away. And our bodies are designed to be in a balanced, symmetrical posture so that gravity is evenly distributed throughout your whole framework. And if you're just slightly out of that normal balanced position, it'll cause stress in the joints. And here you're showing a video of the nervous system. It's this nervous system that really controls your posture through the nerves that are going out to the muscles of your body. So if the nervous system isn't working right, it causes muscles to pull unevenly on your framework, even just slightly, and then it takes the joints out of their normal position. And what the treatment we do is found a misalignment at the top of the neck that affects this nervous system in a way it communicates with the muscles, and then it causes muscles to imbalance, throw the whole posture off, and then you're just stuck in an imbalanced posture where stress is settling into different areas of the body and causing pain.
Well, I think it's interesting how quickly some patients see relief. I mean, for Sarah it was a week.
Yeah.
It's probably different for other patients, though.
It is. It's different. Some people will get up and they'll walk out of the office with all of their pain gone, and they just feel tremendously better. We had a patient just last week who had been suffering from fibromyalgia and was sleeping 2 or 3 hours a night, and we adjusted her, and she went home and slept for 2 days.
Oh my
because she had to catch up. And then there's other
Holy
people that it's more of a slow process, just the way their body reacts.
And here's the actual adjustment right here. Is this the main crux of what you do?
Yeah, there it is. With my hands, I make very subtle, very, very specific adjustments to the top bone of the neck and move it into a position so it's not interfering with those nerves of the brainstem that are controlling the body's posture through the nerve impulses going out to muscles. And it's very gentle. You can ask Sarah. She'll probably tell you.
Sarah, did it hurt?
Doesn't feel like much.
No, not at all.
Well, you didn't even think he did anything, did you?
Honestly, the first treatment, no.
Yeah.
But this is so precise that you do very special x-rays to make sure that that little bone that we talk about is in fact the problem, right? So how in fact do you know if NUCA care is right for whatever problem or problems you're facing?
The best way to look, just by looking at somebody, the easiest way to see if the upper cervical area is potentially the culprit, is to look at the posture and look at the level of the shoulders and the hips and the leg length to see if there's a possibility that muscles are pulling unevenly on the framework causing these distortions. And if we can see that, then we go ahead and take pictures to see if there is a misalignment, and then we correct it.
Do patients ever have to do any follow-up stuff at home or anything like that? Do you give them a plan, a regimen? Or anything?
You know, there's some core muscle strengthening activities that I use, but typically there's really not a lot that I recommend that people do at home other than normal exercise, diet, things that we all know are healthy and will help the body heal faster.
But once you get them back in position, they do need to come see you every now and then to maintain that position because it's a vulnerable area.
Yeah, once we... You know, initially we see people a little more often to, you know, slow down this degeneration and get the body more into a healing mode than a degeneration mode. But after we get people stabilized, you need to get adjusted regularly, just like brushing your teeth. You don't go and get a bunch of crowns and caps put on your teeth and then stop brushing your teeth in the morning.
No, but for people that have had chronic problems for years, I mean, it takes a while for that misalignment to get back in.
It can, and there are people I've seen come in with 40 years of degeneration, and you would just be sure that it would take forever to get them better, and within a couple days they're feeling fantastic.
Yeah.
And then for other people seemingly in the same condition, it takes a few weeks or even months to get them back to where
I'll tell you, if you're not familiar with NUCA, and we weren't until we met Dr. Drummond,
Yeah.
but it's something that's been around for a really long time.
Since
It's just
the 40s, yeah.
only a handful of doctors around the world do it, though. But he does in Omaha. And he brings our viewers a very special offer. So we've talked about these special x-rays, and you think, gosh, that's going to be expensive. Not because you're watching now. So the first 30 people who call his office get a consultation, you get your exam, and then you get x-rays for just $50. And you see the value there, and I feel like that's very conservative.
Yeah,
frankly.
no, it's just one of those deals. If you've had some sort of pain, this is a great opportunity to get in and try
Yeah,
it.
so that's it. We have some information about the number you'll need to call to make sure that you're one of those first 30 people to get a hold of that offer. And it is 452-3400. If you'd like to learn more about Dr. Drummond and the Spinal Balance Health Center, visit spinalbalancehc.com. Thank you for being here. Nice
Thank you for having us.
Yeah, glad you're feeling better.
Yeah,
Thank
no
you.
kidding. And listen, Dr.